I'm here today with Matt Sheehan of University Hospital EMS Training and Disaster Preparedness Institute. Very impressive. Matt, what's going on here?
This is just basic CPR that we're trying to get involved with the community. It's not necessarily having to go through the CPR course, but we're just trying to get urgent people to learn how to do basic chest compressions. Okay, it used to be that they always wanted you to give breaths and all that, but through research and everything, we're finding by just doing basic chest compressions, we're able to return some viable circulation to a patient that may be in full arrest and actually still getting air into the oxygen in the circulating system. So it's just, they want you to do good chest compressions up to 100 a minute.
100 a minute?
100 a minute is what the goal is. Minimum of 100 a minute.
Okay. And your hands are folded that way intentionally for strength?
Yeah, keep your hands together, and they want a full recoil of the chest. They really don't want you bouncing, but they want the whole chest to come up all the way. And just be doing good CPR, so when 911 is activated, you can keep patient viable until they get on scene. And when 911 is available, or if you work in a facility that has automatic electronic defibrillators, most of the time when people go into a full arrest scenario, they go into a ventricular fibrillation. And rapid defibrillation is the key for survival. And many places have these now and purchase them, and they're very simple. You don't even have to be trained to use them, even though they will train the facilities that do have them with their employees. You simply turn them on. This one doesn't have a battery in it, but it would just tell you, apply electrodes. And you would apply the electrodes to the patient, and it would walk you through everything. You know, they tell you stand clear, analyzing, and it would be able to tell if the patient was in a ventricular fibrillation rhythm or where you wouldn't be doing a shot. If it was, it would be telling you to stand clear. It's charging up to the set Joule settings, and it'll shock the patient, and it'll tell you to continue CPR. And what you're doing is that 100 compressions a minute for 2 minutes, and that'll time down. And when it's getting up to the 2-minute level, it'll tell you stop CPR. It'll analyze it again. The patient needs to be shocked. It'll shock the patient, and then it'll tell you continue CPR. Or it'll tell you no shock advised, continue CPR until the actual 911 responders get on scene.
What problems can happen if you do it wrong?
If you do it wrong, you know, the way American Heart is doing things now is just getting on the chest and keeping it in there and doing it wrong. I mean, there are some problems that could arise, but by going out and doing with community services and that, showing people the basic hand positioning and that kind of eradicates the possibility of doing anything.
And the same with the machine. If you use the machine, can you do it wrong?
You know what? If you listen to the directions on the machine, it tells you everything step by step. The pads, do they have pads in here? Pads actually have, no, that's not the pads. They tell you the placement of where to put the pads, hooking it up to electrodes, and it all walks you right through everything. It's all automatic.